Good evening, everybody. So today we are going to talk about hypertensive retinopathy. Hypertensive retinopathy, when you talk, this is because of high blood pressure. And the reason of your hypertension, I think everybody knows, maybe genetic, or it may be because of acquired condition like emotion. And because of that, there is a vascular constriction. So now, when the vascular constriction remains for a longer time, it can lead to structural changes, and that constriction remains for a longer time. The vascular wall becomes thickened, and all other changes in the retina occurs. See, whenever the changes in the retina, that is in the eye, occurs, same changes occurs in all other organs also. Because in the eye we can see, we can do fundoscopy, ophthalmoscopy, and we can know that these are the changes, and same changes are going on in other organs. Now, when acute hypertension, that means suddenly if there is a high blood pressure, that can lead to constriction of the blood vessel, and the blood supply to different organs reduces. Now, when this blood pressure remains for a longer time, there is a endothelial changes in the vessel wall. And when this remains for a longer time, there is a necrosis of the vessel wall, and it leads to exudation of the serum from the blood in the areas or in the tissues, which will tell us about the exudates. And even the blood cells are also exudes from the blood, and that tells you about the hemorrhages in the retina. Now, this changes. If you say there are various grades of hypertension, initial grade is that there is just a narrowing of the blood vessels. That means there is a constriction of the blood vessels. Second is about the AV nipping. AV nipping is what, wherever there is a crossing of the artery and the vein, there is a pressure of the artery on the vein. So there is a narrowing of the vein in that area. So always remember, whenever ophthalmoscopy is done, and if there is a AV nipping, that is AV nicking or AV nipping, always whenever this finding is there, always it is related with the heart, and you should go for a investigations of the heart also. Then third grade is hemorrhages and exudates. I just told you about this, how the hemorrhages occurs and how the exudates occur. And the fourth is known as a malignant hypertension, where there is an optic disc swelling and there is a macular edema, macular swelling. The vision also reduces. So these are the four grades. Out of all, most severe grade is about the fourth grade. Immediate attention has to be done for the patient. Here you can see all other organs are also involved. Like in case of hypertension, the eye is involved, the heart is involved, the kidneys are involved. And the symptom in case of hypertensive retinopathy, whenever the macula is affected, there is a reduced vision. Sometimes there is an eye swelling also, and there are hemorrhages. So many patients, they come with a subconjunctival hemorrhage, and that time when we check the blood pressure, we come to know that patient has got hypertension, because the subconjunctival hemorrhage is so bright and red color. Patient is really scared about all this thing. And sometimes there is a lateral rectus palsy leading to double vision also. So examination is very important. Vision checking, fundus examination, checking of the blood pressure, all these things very important. So whenever you get all the other investigations for the heart and the kidneys has to be done. And along with diabetes, if there is hypertension, the changes are more in the retina. So control of diabetes and hypertension is very important. Examination when we have to do with the 90-day lens under the slit lamp examination, and with the ophthalmoscope fundus examination we have to do. Here, when we talk about hypertension, most important is about the emotion. We have to control our emotion by doing meditation, a salt-free diet you have to take if you have got hypertension. And in neuropathy, there are many drugs which can be taken. But your lifestyle changes is very important. And for calming of the mind, homeopathy also definitely works.
All right. So I hope you can hear me and see me okay. And I think Dr. Pushpa has already discussed about hypertensive retinopathy and the pathological process that happens there. And I want to talk to you about the homeopathic approach in hypertensive retinopathy. And like in every of our session that I talk to you about, the individualization remains our main forte, where the idea is to find the remedy for the person. And as you know, in homeopathic case taking, we try to go in different areas of one's life, the physical generals, the emotional state, the patterns, and based on that, we try to find a remedy, which basically helps the body's psycho-neuro endocrino immunological axis to work on the pathological process. However, there are certain homeopathic remedies which I want to tell you have a very big action or are very important for this kind of hypertensive retinopathy. One of the most important remedy, and if you can allow me a share screen, Dr. Megha. If you can allow me share screen.
Yes, sir.
Okay, this is good. So one of the most important remedy, like I was telling you, clinically, which is written in clinical literature, is spigelia. Spigelia is one of the most important remedy. It belongs to Loganiaceae family, Ignatia family, and it has a very specific action on the eye. Every spigelia patient will have a lot of radiating pains from the eye, sometimes going above, sometimes going to the ear, sometimes going to the below. All the symptoms are aggravated thinking about it. And always spigelia patient is better by lying down and drinking something warm. Another very important symptom for spigelia, better by heart pressure. In all of these cases, in hypertensive retinopathy, one of the biggest remedies is spigelia. The pain is in and around the eyes, and very often you will see the patient will tell you it is almost like needles are piercing in it. And the other very important thing is a lot of lacrimation, which is very profuse. Very often you are giving this patient euphrasia or something like that. The final symptom, which is also very important, is difficulty in raising the eyelids with stiffness. So they cannot open the eyelids like that. It's a very, very important remedy. Spigelia has a state of Loganiaceae, like Ignatia family. Very often I have found in Spigelia history of lot of grief, history of lot of mental shock, history of a bad news affecting them. So this for me is a very important remedy. Clinically, O.A. Julien, the French author, has also written about the remedy cicuta being a big remedy for hypertensive retinopathy. However, almost all the remedies which are important for hypertension, for congestion of the blood vessels, like strontiana carb, like belladonna, like glonoin, like aurum metallicum, like strophanthus, like spartium, scoparium, all these are very important remedies for the eye as well. One lesser known remedy is natrum salicylicum. Having said that, I found the best results when I individualize the case and find the remedy for the person. But these kind of clinical tips can often help you as well. So that's the idea today. The future of these kind of pathologies, especially is holistic treatment. We have an integrated homeopathic setup here, where along with homeopathy, we work with nutrition, movement, yoga together. Sometimes patients are parallelly also taking allopathy. In some cases, they are frustrated with allopathy and just want to take homeopathy and nutrition and movement. So this is the entire idea. If you need my help of our team, you can write to me, gaurang@gmail.com, and there is a phone number below for our consultation wherever you are, whichever part of the world. Thank you so much.